Welcome back to Strategy Saturday. This week I changed something in my workout routine, and I think it was one of the smartest shifts I've made in a while. Most of you know I strength train twice a week, total body, 3 sets of 10. I do single leg quad and hamstring work on a resistance machine with 75 pounds, a reclined leg press, single arm rows with a 30-pound dumbbell. I bench press, I do bicep curls, some back extensions with a barbell, tricep press, and some medicine ball core rotations. That's my foundation. But this week I added something new, sprints. Not on a pavement, my ankle arthritis would not tolerate that at all, but on the rower. I did 5 rounds, 20 seconds all out, then active recovery till my heart rate comes down, and then I do it again. It lit up my lungs, my legs, and I could feel it deep in my core, exactly where visceral fat likes to hide. And I'll be honest, another reason, probably the main reason I added these sprints is because I had a flare up of my atrial tachycardia. It happens to me every couple of months, usually when I let hydration and electrolytes slide. But oddly enough, it never happens when I'm exercising. This last time it was triggered just by sitting down quickly. What happens is the blood rushes back to my heart, the atria will stretch fast, and boom, tachycardia. So I started asking myself, can this kind of high intensity training help my heart with sudden volume changes improve? Can I train it not just to be strong, but to be adaptable? That's part of why I'm doing it, not just for fat loss, but for a more resilient heart. Now, let me tell you why these 20-second sprints matter. First of all, visceral fat, that deep, dangerous fat around your organs, the kind that's linked to insulin resistance and inflammation. It responds best to bursts of high intensity. Sprints increase adrenaline and growth hormone, and those two unlock visceral fat far more quickly than a slow walk or steady cardio. Second, my heart. But sprints challenge the heart in a different way. They increase your stroke volume. That's the amount of blood pushed out of the left ventricle in one contraction. It also helps to improve how fast your heart rate recovers and train your cardiovascular system to handle stress and bounce back. That's especially helpful if you're someone like me who sometimes gets rhythm issues triggered by sudden changes in blood return, or even if I'm watching an emotional movie when you just feel emotional, not crying or anything, it's suspenseful or something like that. It happens to me. Third, they're fast. My sprint workouts take under 10 minutes. No treadmill marathon, no 45-minute bike ride, just all-out effort, short recovery, and done. And afterwards, insulin sensitivity increases, mitochondrial function improves, and your body stays in fat-burning mode for hours. So for those asking, no, this does not mean you go full throttle every day. Did we all hear that? This is a high intensity stressor. Too much can backfire. I'm keeping it to once a week, 5 to 6 rounds of 20-second hard intervals, 1 to 2 minutes easy. If you're new, start with 10 seconds or 3 rounds. You can build. And yes, I'm watching how my heart responds. Just like some of you want me to do with a creatine experiment and report back, I'll do the same with this. Zone 2 cardio is amazing for endurance and metabolic flexibility, and I still love it. And if you want a full deep dive, what I'm describing here is atrial preload, vagal tone, electrolytes, and whether HIIT protects or provokes arrhythmias, let me know in the comments. That might be my next long form video. Muscle is your retirement account, and sprints are your emergency fund, and together they make you harder to kill. This is Dr. Rose, the Primal Professor. I'll see you in the next Daily Spoonful.